So it was yet again a urogynecology OPD on a Tuesday afternoon when I saw the patient coming directly towards me. I recognized her face. She is the one we had operated just 2 weeks ago for a condition called stress urinary incontinence. Now, if you don't know what stress urinary incontinence is, let me tell you, in this condition, the urinary bladder and the bladder neck and the tube that connects that bladder to the exterior, that we call as urethra, becomes loose or loses its tone, so that whenever there is increase in intra-abdominal pressure, the bladder cannot hold urine, as in laughing, sneezing, coughing, and suddenly it gushes out abruptly. And it is a very embarrassing situation, as you can understand, for the lady. And this particular lady was suffering with this condition for 10 long years. So when she had come to us, we had diagnosed the condition, operated on her, and sent her on second post-operative day, and she was fit and fine. And now she was here. That surprised me a bit, because usually we call these patients, whenever we operate, we call at least after a month, and she was here in 2 weeks' time. I was worried, what has happened, what brings her here today? Is she having a complication? And I was little concerned and little worried for her. Anyway, the lady came inside, she sat in front of me, and as soon as she sat down, she started crying. Oh my God, that was a nightmare. What has happened to her? And she composed herself in a few seconds, and she told me something which I always remember. She told me that yesterday, doctor, I went to a movie with my friends, and it was a comedy movie, and would you believe, for 3 hours there, I kept on laughing without the fear of embarrassment of leaking down there. I never thought that this day of this kind of little pleasure or joy will come to my life ever again. And then she touched my hand, which was kept on the table, and she said, "Thank you." Her words still echo, still reverberate in my mind every day when I see my patient. That's what we aim to do in urogynecology. Bring a little bit more quality to your life, a little more smile, a little more laughter, and a little more compassion to your lives. So what is this urogynecology all about? As soon as I ask this question, I'm sure the first thing that flashes in your mind is it urology? If you are also thinking that, no, it is not. Urogynecology and urology are two entirely different medical specialities. So if we have to understand what urogynecology is, maybe you have to come with me. We have to go back in time, thousands of years back in the history, when there used to be one doctor and one community. And that one doctor used to take care of every possible thing, starting from fever to abdominal pain, to bone problems, to cancer, and even pregnancy and whatnot. Slowly, as we understood a lot more about health and disease, we diversified. We specialized into specialties and subspecialties. Like head and neck, one group of people started seeing, heart, one group of people, lungs, one group of people, so on and so forth. And when it came to the lower part of abdomen, we call it pelvis, there it also again was divided into 3 components. The first compartment, that contains urinary bladder and urethra, went to the urologist. The posterior compartment, which has rectum and intestine, it went to the colorectal surgeons. And the middle part came to us, which has reproductive system of a female, to the gynecologist. But that time, a big mistake we did. We totally forgot, or we totally ignored a very, very important organ, that is what we call as pelvic floor, which holds all these organs together in place. It is one organ and cannot be divided into 3 subspecialties. And because most of the times these problems of pelvic floor are because of childbirth and get aggravated because of estrogen deficiency seen during menopause, it was supposed to come under, it was a very logical thing that a gynecologist should treat it. And American Board of Medicine as late as in 2011 realized that it should be made a subspecialty, and they call it urogynecology, and the official name of this particular specialty was, or it was given as, female pelvic medicine and reconstructive surgery. So from 2013 onwards in America, they have board certified fellowships for that. So it is a very new branch in our medical science. Later on, Europe also started the same thing. They do not have a format for a fellowship, but they do certification from their societies. In India, we are still at a very infantile stage of this, and we have less urogynecologists to handle the problems. But as always in Kasturba Hospital, we have been the pioneers, at least at the national level. So when all these buzz was happening in 2011 to 2013, we started getting trained. And in 2018 January, we started our dedicated OPD for urogynecology patients. Last year, we have started courses for that, and then we integrated a clinic where we have a physiotherapist, a counselor, a psychologist, and together we try to make these lives a bit better. Now, what happens is that when we see so much, we say that so much training we are doing, so many OPDs we are, the question is that do we really need it? Philosophy is okay, but in numbers, do we really need so much expertise and so many people to be trained, so many OPDs to be started for that? So the answer is yes. And to tell you or to prove that, I will go into the numbers. So the numbers say that if you take all women together, every second lady in our society is suffering with some kind of pelvic floor disorder. And every ninth lady is a candidate for some kind of surgical treatment related to urogynecology. And if we look at the global prediction, it says that by the year 2050, which is just 30 years ahead, the rate of growth, if that is X, we will be needing 2x, 2 times of that urogynecologists to take care of these patients. What does this mean? It means simply that all obstetricians together who take care of antenatal patients, deliver them, high risk, low risk, everything. If that requirement is X, we will need 2x urogynecologists globally to take care of the increasing need. Now, from where these patients are coming? So the answer is simple. Only two things are important. Number one, that the life expectancy of women is increasing, and number two, there is more awareness about the quality of life now. So I think this quality of life concept is very, very crucial, because it is not important that how many days we have in our life. What is important is that how much life we have in each and every day we live. And we are trying to achieve that. More and more people having more quality of life. And in this lockdown period, I think all of you, all of us have got this opportunity. We have more time to interact with your family. So today, get up, talk to your mothers, talk to your aunts, talk to your wives, to those people who matter to you most. Talk to them and find out if they are also silently suffering from years with these kind of embarrassing situation. Let's together bring a little more happiness, a little more spark, a little more laughter in their lives. Thank you.